10 years ago, a water crisis began when the city of Flint, Michigan switched to the Flint River for its municipal water supply. The more corrosive water was not treated properly, allowing lead from pipes to reach into many homes. Ash-har Quraishi went to Flint to speak with residents about what the past decade has been like.
An American city sickened by its own drinking water.
These are all your medications?
Yeah, I was, prior to 2015, January of 2015, I was on one multivitamin every day.
How many pills do you take a day?
I take 15 prescribed pills every day.
Melissa Mays became one of Flint's loudest voices. She's among tens of thousands still waiting to see any payment from a $626 million class action settlement for their exposure.
We're trying to be civil, and yet no one's in jail. The pipes aren't replaced. The yards aren't fixed. We don't have health care. Basically, what we were told was that it's okay to poison us. We don't matter.
Trouble began when the city, in economic freefall, disconnected its water supply from Detroit's system and began drawing from the Flint River instead. It was a bid to shave millions off the city's budget. The Centers for Disease Control and Prevention estimated 100,000 people were exposed when the corrosive chemicals used to decontaminate Flint River water allowed lead from the pipes into faucets. At least 12 people died from Legionnaire's disease, brought on by bacteria in that water. Results from children's blood tests were a red flag for one pediatrician.
There is no safe level of lead.
By summer 2015, Dr. Mona Hanna-Attisha discovered that the number of children with dangerous levels of lead in their blood doubled.
That is the moment my life changed. As a pediatrician, we know what lead does. It's damning. It is a potent, irreversible neurotoxin. There's no safe level. It erodes cognition. It twists behavior. It can alter the life course of a child, and worse, it can alter the life course of a population of children.
Dr. Hanna-Attisha is now the Associate Dean for Public Health at Michigan State University's College of Human Medicine.
It's pretty stunning that to this day we continue to use the bodies of our kids as detectors of environmental contamination.
She estimated some 14,000 children in Flint may have been exposed.
Almost like it was some sort of a pandemic that Flint had been through.
James Prue joined a class action lawsuit after his 8-year-old daughter was exposed.
She had a certain amount of lead in her system.
When you found that out, that she had lead in her blood, what did you think?
There's learning disabilities that go along with it, so I thought, she's going to be out for a tough future.
I am sorry, and I will fix it.
Then Governor Rick Snyder was among 9 current and former Michigan officials charged criminally 7 years after the crisis began. But the cases collapsed after the state Supreme Court said the charges were brought improperly by a one-judge grand jury.
There is lead in the drinking water, but it's considered below federal safety limits. The population here has dropped by about 20,000 over the past decade, but it's still fresh in the minds of people we met. Has it faded at all from the forefront of the minds of people in this community?
I would say no. It's not all the way healed. We can still see construction going on with pipes and things like that.
In 2015, at age 8, Mari Kopany, crowned Little Miss Flint, became an activist. Now 16, she's frustrated by inaction.
Have things gotten better?
No. Honestly, we still don't have clean water. Isn't that so crazy? Isn't that so crazy? We haven't had clean water, and it is 2024.
What would you like to see happen?
Getting clean water, finally. Getting our lead, getting our pipes fixed.
We can't recover until the water coming through our pipes stops hurting us, until it's actually clean and safe for everyone in Flint. And that's not happening.
And Ash-har Quraishi joins me now. Ash-har, what does the federal government have to say about whether or not the water is safe to drink?
Well, we posed that very simple question to the U.S. EPA asking, is the water in Flint safe? And a lot of residents would hope that the answer would be seemingly simple as well. What we got in response from the EPA was that a lengthy response that talked about testing, retesting, compliance, and investment in infrastructure. But nowhere in that lengthy response was the word yes.
Ash-har Quraishi, thank you for your reporting.